Information from RFSU about childbirth. When you are pregnant and the delivery is getting close, there can be many questions and feelings that arise. You can attend courses that will prepare you for both childbirth and parenting. Your midwife is responsible for providing you with the information and support you need. In Sweden, most births take place in hospitals where there are healthcare professionals available. Most people will also have someone with them for support during the birth. Find out in advance how many people can be there and think about who you want to have with you. You may feel more secure if you plan in advance how you will get to the hospital and with whom. You also have the right to an interpreter during the delivery. If you have been subject to genital mutilation, or circumcision as it is also called, and sewn together, it is important to inform your midwife so that reopening surgery can be done before the delivery. Staff are then prepared and can provide you with what you need to feel comfortable and safe. You will not be re-sewn together afterwards. That is illegal in Sweden. Childbirth will usually begin with cramps. When they start, you will need to call the maternity ward for advice on when you should go to the hospital. If the delivery starts with bleeding or the fetal waters break, you should always call the maternity ward or go there. You will usually stay at home for the first few hours before going to the maternity ward. It is important to rest, drink, and eat so that you have strength for when it is time to go to the hospital. It can take several hours from the first cramps to when they become regular and stronger. There will be pauses between each cramp. Childbirth can happen very quickly, but it can also take many hours. Your first childbirth may take longer. You'll be supported by a midwife and another healthcare professional who will also help you if you need pain relief during the birth. In some cases, when the baby or the mother are not well or are distressed, a caesarean section may be needed. A caesarean section is an operation in which the doctor makes an incision in your stomach and uterus and lifts the baby out. It may be planned or an emergency procedure. During the final stage of the delivery, the baby will begin to press downwards, which can result in a feeling of both wanting to push or squeeze and hold. It is not unusual to feel tired during the delivery. It is important that you are supported by both those you have with you and by the midwife. The midwife will help you push in the correct way and find the right position. Once the baby has been delivered, it will be dried and placed skin to skin so the baby feels warm and secure. After a moment, it will be time to cut the umbilical cord and the placenta must be passed. Your vagina will be examined to check whether you have ruptured. Some types of rupture require stitching, while other ruptures will heal themselves. If you have any questions about childbirth, talk to your midwife at the maternity ward. Everyone who is delivering a baby has the right to a safe and secure childbirth.